works by changing of the any situation around us or any, do you see, increasing or decreasing of our mobility. Parasympathetic system, it works constantly. It is protection for the life and working of the whole organism. It is protection for the working and life of the concrete individual organ. And like sympathetic system, do you see, it is not controlled by our consciousness, and it is antagonist of the sympathetic system. If you remember, I gave you by last time examples when the sympathetic and parasympathetic systems, they can work like synergies. But very often, parasympathetic system, it has the central part, and central part is placed in the brain stem and in the sacral region of the spinal cord. And it is formed by special vegetative nuclei. In the brain stem, we started this nuclei by last semester, now I will recollect them. The center which is placed in the brain stem, it is called cranial, and it divides into the mesencephalic and bulb. In the mesencephalon are placed two nuclei for the smooth muscles, and this will be accessory nucleus of the oculomotor nerve for the sphincter pupil muscle, and this will be the intermedial median nucleus for the ciliary muscle. Sphincter pupil muscle, what it does? It decreases the visit of the biggest light to the retina because it is protection for the retina. If the retina, for example, by light from exclusion will die, the vision organ will not be important for us. We will lose vision. Listen to me. And also the ciliary muscle, it does accommodation. Do you see? For example, if we cannot do accommodation, for example, we cross the way for the car can push us, do you see? And we can die also. Because this, do you see, muscles which so for the protection of the vision organ. Another nucleus is placed in the bulb part and concretely in the pons. It is called salivator superior nucleus. Salivator superior nucleus, it exits from pons by facial nerve. I want to recollect you. The vegetative nerves, they don't go long. They go to their object by transport. This transport can be somatic nerve, or this can be vessels. Or today we will study some another transport for any vegetative nerve. You can see vegetative nerves don't go long. Do you remember some seconds ago I explained you accessory nucleus of the oculomotor nerve and intermedial median nucleus, from which the vegetative nerves will travel into the orbit by oculomotor nerve, which is somatic. With oculomotor nerve, it will come for the control of the skeletal muscles which rotate eye in the orbit, and they bring into the orbit the vegetative portion. Salivator superior nucleus, do you see, it gives the vegetative nerves, vegetative portion, which travels by facial nerve into the, it directs to its objects. And another, do you see, from salivator superior nucleus will be controlled lacrimal gland and the sublingual submandibular salivary glands. Do you remember by last semester I gave you example, interesting example. Lacrimal gland and do you see, sublingual and submandibular salivary glands, they get information from one nucleus. And each nucleus, vegetative, it for the giving of the order to the objects, it must get information about condition of these objects. And you can see information comes to the one nucleus from, for example, salivary glands. And salivary glands gives the order to the lacrimal gland because nucleus is long and to the salivary glands. And I gave example. Do you remember when crocodile eats, it cries? And also, no, in your country it's easier to see this example, but you can check this example here. For example, you will come at home and you will start eating with your colleagues. And try to look at eyes of your colleagues before eating. No, 30 minutes, 20 minutes before eating. And after that, try to look at eyes of your colleague by eating. Their eyes will shine more than the before eating because the salivary glands increase production of the salivary fluid, and for them gives order the salivator superior nucleus, and by same moment it will go to the lacrimal gland. From salivator inferior nucleus, which is placed in the medulla oblongata, the vegetative portion will direct out by nerve number 9. This is glossopharyngeal nerve. And this information, this order to the objects can go very fast. We cannot come to the objects very fast because, for example, there is the oculomotor nucleus for the somatic nerve, and do you see salivator superior nucleus? It is placed near the motor nucleus of the facial nerve for the expression muscles. Glossopharyngeal nerve, it gives order, for example, to the sternopharyngeal muscle, but together with the somatic nuclei in the center are placed the vegetative nuclei, because impulse exits from center by very fast velocity, near 120 meters in 1 second. Do you remember last time I showed you, I will push her by needle and she will do reflex. Impulse from my contact to the center and from center by reflex arc will go very fast. Listen to me. Try to associate from, for example, salivator superior nucleus, the impulse will come to the lacrimal gland. Every time lacrimal fluid will cover our face. Do you see? And do you remember I said you the vegetative nerve system, it controls the every time you produce me this discomfort, every time I must stop my explanation and produce attention for you. Get the normal medical image and come. If you remember, I said you sympathetic or parasympathetic system. These systems they go to the from center to the objects by very fast velocity, but they cannot come to the objects with very fast velocity. What sympathetic and parasympathetic system do? They control smooth muscular tissue and secretion tissue. And smooth muscular tissue, it completes into the more of hollow organs, into the walls of the stomach, into the walls of the intestine, do you see? And try to associate. If the impulse from center will come, do you see, to the smooth muscular tissue of the intestine, and velocity will be like for the somatic nerve system. Our peristaltic movements will be like here. We will live, study, and work in the toilet. Try to understand our heart. Myocardium is controlled also by vegetative nerve system. You can see, if do you see, it will control by 120 meters in 1 second. The blood cannot enter, the blood cannot exit. We cannot die. Because impulse from centers, from somatic or from vegetative exits with very fast velocity. But it comes to the objects only with very slowly velocity. Why? Because the impulse passes through the stations. These stations are called ganglions, vegetative ganglions. For example, do you remember from accessory nucleus of the oculomotor nerve and from intermedial median nucleus impulse comes by oculomotor nerve into the orbit. And here for it waits ciliary ganglion. What will be in the ciliary ganglion? Each axon which completed into the vegetative nerves, do you see, it divides into the terminal ends. And each, do you see, this division will do synapse with any individual cell, which is a cell of this collection in the ganglion. You can see this axon brought the biggest portion of the order with very fast velocity and gave for the many cells by division into the terminal ends. And each cell will get only smaller part from this big order. And because the portion of the order decreases and velocity decreases, and the axon which came by the collection in the vegetative nerve to the ganglion, it has myelin sheath. Myelin sheath, this is protection for the exit of the electric impulse. This stops exit of the electric impulse. After multiplication, when the one axon divides into the many branches, many terminal ends, do you see? And after decreasing of the velocity, from ganglion will exit postganglion fibers without myelin sheath. And they will be without myelin sheath, and the velocity of the impulse by these postganglion fibers will be from 2 till 20 meters in 1 second, very lesser. And because we have slowly peristaltic movements, do you see, the slowly contraction of the heart, do you see? And this is slowly production of the some secrets by glands. And for the vegetative nerve system, for the sympathetic and for the parasympathetic is very important characteristic. When the impulse comes to the ganglions, and after multiplication in the ganglions by which impulse will decrease, the postganglion fibers without myelin sheath with a slowly velocity will bring impulse to the objects. You can see, I want to recollect you, vegetative nerves don't go alone. They travel by transport, by somatic nerves or by vessels. And you can see they pass through the ganglions every time for the visit to the objects. There are my examples about oculomotor nerve, glossopharyngeal nerve, facial nerve. They brought the information, and they brought the order to the ganglions. And ganglions will be for the decreasing of the impulse for the multiplication, and also for the change. This will be stations for the changing of the transport. On the face, the whole sensitive, each pointing of each tissue, sensitive of this pointings is controlled by trigeminal nerve. And the oculomotor nerve, facial, glossopharyngeal, brought, the order to the stations for the decreasing of the impulse and for the changing of the transport. After these ganglions, the impulse will go by vegetative fibers along of the branches of the trigeminal nerve, because it enters everywhere and it is very easy transport for the continuing of the traveling of the vegetative portion. Did you understand? Okay. This vegetative ganglions, ciliary ganglion, where is placed? In the orbit near the eye. The pterygopalatine ganglion from each impulse will go by facial nerve. At first to the ganglion will come by facial nerve, from it by trigeminal nerve into the orbit. Pterygopalatine fossa, it communicates with orbit by inferior orbital fissure. Very short distance for the orbit, for the visit to the lacrimal gland. Sublingual ganglion is placed on the external side of the sublingual gland. This all The otic ganglion. Otic ganglion, it is placed on the near the parotid gland on the auriculotemporal branch. You can see these all ganglions, they are placed near the organs, and they are called extraorganal ganglions. Extraorganal ganglions. Extraorganal ganglions, they are for the parasympathetic system. And also for the parasympathetic system will be intraorganal ganglions. If the organs have pocket shape or tube shape, for example, stomach or intestine, will be serous sheet, will be muscular sheet, and will be mucus sheet. Between serous and muscular will be collection of the ganglions. They will not be covered like a capsule, they will not be covered by capsule like ciliar, pterygopalatine, otic. And they, do you see, will be collection of the some, do you see, individual cells in the any place compactly. Only compactly they are located. Maybe by 10, maybe by 50, maybe by 100, do you see, in any place. But if they are placed compactly, this collection, this will called ganglion, and they will called subserous, between serous and muscular. Between layers of the muscular sheet, because the all hollow organs, they have longitudinal circular, stomach has longitudinal circular oblique. Between layers will be intramuscular ganglions, and between muscular sheet and mucus sheet will be submucous ganglions. For what we have subserous, intramuscular, and submucous. Impulse by preganglionic fibers with very fast velocity will come to the subserous. From subserous will direct to the serous glands, postganglionic fibers. Do you see into the intramuscular, from intra or intramural intramuscular will direct to the myositis which complete into the muscular sheet. Submucous, to which will come preganglionic fibers, from them to the mucous glands, to the glands of the mucous membrane will come the submucous. These glands are called intraorganal ganglions. Intraorganal ganglions. For the parasympathetic system, we have ganglions number 3. Constant number 3. Why I will recollect you? Number 1. This will be paravertebral for the sympathetic system. Number 2, this will be prevertebral for the sympathetic system. Number 3, this will be subdivision into the extraorganal and intraorganal. But together, do you see, they have the same number 3. But they will be extraorganal and intraorganal. But I explained you extraorganal for the head, but also we have extraorganal for the parenchymatous organs. For example, we have lungs. Do you remember? No, lungs include mucous membrane, and also do you remember terminal bronchioles of the lungs? They include the smooth muscular tissue, which must get information, which must get the odor from vegetative center. Do you see? But for the lungs, for the liver, for the kidney, for the spleen, what organs have? These organs have hilus, door. Do you remember? In the door will be ganglions. They are not in the tissue, they are in the door. But because they are called the extraorganal ganglions. Very important for our life, the organ which is heart. Because heart is pump which directs to the whole organism, to the all tissues, oxygen and the things from nutrition, and evacuates dioxygen and things from metabolism. Because our architect, which built our organism, gave for the heart more of ganglions. For the heart, we have two big groups of the ganglions, and this will be extra-organal and this will be intra-organal. By last semester we studied the heart. And look please here, do you see from heart exits ascending aorta which does arc of the aorta. Here from in front, from right ventricle will direct, do you see, will direct to the back, above and to the back for the division into two arteries, pulmonary trunk. Do you see? On this concave, do you see, of the aorta, between division of the pulmonary trunk into two pulmonary arteries, will be the extra-organal superficial plexus. What is plexus? Here will be many loops of the nerve threads, and do you see these loops will be bodies of the neurons. Do you see? This will be superficial extra-organal plexus. Here will be arc, here will be trachea. Trachea divides into two bronchs. Do you see? With this will be bifurcation. On posterior side of the concave of the aorta, between bifurcation of the trachea, will be deep extra-organal plexus with deep, do you see, vegetative ganglions. Do you see? You can see this is extra-organal plexus which divides into the superficial and deep. Some fibers from vagus nerve, because another center of the vegetative nerve system, this is dorsal nucleus of the vagus nerve. It is placed in the medulla oblongata. In the medulla oblongata is placed the elevator inferior nucleus for the glossopharyngeal nerve and the dorsal nucleus of the vagus nerve, because this will be expanding upper part of the spinal cord. This will be bulb, because this is called bulbar center of the vegetative nerve system. Dorsal nucleus of the vagus nerve, it is very, very biggest. And because we can say about vagus nerve like about king for the parasympathetic innervation. Why? It controls on the neck, thyroid gland. It controls organs of the thoracic cavity. It controls organs of the upper floor and the medial floor of the abdominal cavity, except pelvic box. Do you see, my dear? It continues, do you see, below till, do you see, pelvic box. It doesn't enter into the pelvic box. It controls the all parenchymatous organs, the whole secretion tissue, and the whole smooth muscular tissue, and also myocardium of the heart. You can see this is vagus nerve. Vagus nerve we have right and left, no, like all another cranial nerves. So we have right and left. And listen to me, by last semester you studied vagus nerve. It includes somatic part and it includes vegetative big portion for the its king function. And you can see the following. Vagus nerve we will differentiate by our vision on the neck. It joins from laterally to the carotid common artery. And why we can differentiate it individually? Because I said you, more of nerves we cannot differentiate because they complete into the somatic nerve. Because here on the neck, the vagus nerve consists somatic portion and vegetative portion. I want to recollect you. Vagus nerve gives the motor somatic branches. Palatine, pharyngeal for the muscles of the pharynx, laryngeal superior nerve, which comes from upper to the muscles of the larynx and controls the skeletal laryngeal muscles above them, the vocal fold and the vocal muscle also. And another continuation of the vagus nerve below, it is called recurrence laryngeal. Why recurrence? because it wants bring below vegetative portion. And it comes, do you see, into the thoracic cavity, rotates, and comes back. Why it, do you see, comes into the thoracic cavity? It gave below the vagus nerve for another transport. Do you see? And it rotates and comes back, and when it enters into the larynx from lower, it changes its name. It is called laryngeal inferior. It will control all muscles of the larynx below than the vocal fold, and vocal fold will be controlled by, vocal muscle will be controlled by laryngeal superior and laryngeal inferior together. Do you see? And for what it came into the thoracic cavity, and after that it directed above. It came for the giving of the vegetative portion to the another transport. And another transport, especially for the esophagus, will not be arteries, will not be nerves. This will be esophagus. Right nerve, vagus, will join to the posterior side of the esophagus and will travel below by it. Left nerve, do you see, will join to the anterior side of the esophagus and will travel below by it. When these nerves go below, look at me, these nerves give pulmonary branches, this nerve will give cardiac branches, this nerve will give esophageal branches. To the myocardium, to the secretion cells of the esophagus and to the smooth muscular tissue, and to the lungs, to the, do you see, secretion tissue and to the smooth muscular tissue. But I want to recollect you, this is embryon. Do you see? In the embryon, at first develops primary intestinal tube. Primary digestive tube, excuse me. Primary digestive tube. It divides into the, do you see, anterior, medial, and posterior region. Medial region expands to right side. And from this expanding part will differentiate the future liver and stomach. Liver will stay on its place, will differentiate and will stay on right side in its place. Stomach, it must contain by small intestine. In our organism, the small intestine has distance near 5 meters. In the newborn is near 1.2 meters in the newborn. But this is embryon, and here the expanding the stomach. And stomach must contain to the small intestine. How it will locate in this smaller organism? Do you see? It will try its rotation to the opposite side. This is very, very slowly. For what? For the correct comfort location of the loops of the small intestine. And by fetal life, do you see, the gastrointestinal tract rotates by 180 degrees to the opposite side. At first, stomach, do you see, will be, do you see, on right side, and after that it, for the comfort location of the loops by crossing of the small intestine, will rotate to the opposite side. And do you see, before, and small intestine continues into the large intestine. And in the fetal life, in the, do you see, primary fetal life, and primary fetal life, it begins from 4 months of the, do you see, life in the uterus, do you see? And we have, do you see, in the fetal organism, at first we have the opposite position of the cecum and vermiform process. And when the stomach rotates, do you see, the whole intestine, do you see, changes, do you see, its position, large intestine also, because gastrointestinal tract rotates by 180 degrees by norm. So sometimes can be malformation which is characterized by, do you see, stopping of this rotation. No, in our anatomical set, we have some preparat of the gastrointestinal tract of the fetus, which didn't have rotation of the gastrointestinal tract. But for what I recollected you about rotation of the gastrointestinal tract by 180 degrees to the opposite side. Listen to me. Do remember, esophagus in front will be left vagus nerve, which travels below, behind was right. When the stomach, look at me, when the stomach rotates, the abdominal part of the esophagus also rotates. The right nerve at first traveled by posterior side, it will come in front of. The left nerve will direct to the back. When these nerves come by esophagus into the abdominal cavity, they do the same situation which splanchnic greater and splanchnic lesser nerves of the sympathetic system did. Do remember, splanchnic greater and splanchnic lesser come into the abdominal cavity and spill into the individual nerve fibers, and they will cover the vessels, and will get the name plexus, which will accord name of this vessel. Will be celiac plexus, because this net will be around of the celiac ganglion. And vagus nerve will spill and will spill into the nerve fibers and will complete into this plexus. And this plexus, do you see, will be mixed and will direct to the, for example, by gastric left plexus, by hepatic common, gastroduodenal, do you see, pancreaticoduodenal superior, gastroepicleal, how the celiac trunk will subdivide. The net, which is formed by nerves and covers it, will subdivide into the lesser portions, which will get names of the arteries, which will be subdivisions of the celiac trunk, and will come to the objects. This, for example, gastric left plexus, for example, it will be formed only by postganglionar fibers for the sympathetic system, because some fibers from thoracic, from lateral horns of the thoracic segmenters, do you see, passed through the sympathetic trunk and did multiplication in the sympathetic trunk. Some of them will pass without multiplication through the sympathetic trunk, will complete into the splanchnic greater, splanchnic lesser, and will come to the celiac right or celiac left, and here will do multiplication. I want to recollect you the following. For the sympathetic innervation of the organs of the abdominal cavity, you see, we have two ways of the vegetative order. 50% of the vegetative nerves which exit from lateral horns will do multiplication for the decreasing of the impulse in the sympathetic ganglions of the sympathetic trunk, and after that by splanchnic greater and splanchnic lesser nerves, which will include the postganglionar fibers, will complete into the celiac plexus, aortic plexus, mesenteric superior, mesenteric inferior, and will direct to the objects. And another 50%, they will go directly without multiplication through the sympathetic trunk, will complete into the splanchnic greater lesser, and will come to the special pre-vertebral ganglions. Some will come to the celiac right, celiac left. For the intestine will come to the mesenteric superior or mesenteric inferior. Two ways for the visit of the sympathetic nerve to the objects. Some will pass through the sympathetic ganglions of the sympathetic trunk. After that, two organs will go, do you see, postganglion fibers. Some, do you see, will come to the prevertebral ganglions without, do you see, multiplication, and only in the prevertebral ganglions will decrease impulse by multiplication, and will go to the organs by postganglionar fibers. This is sympathetic. I recollect you sympathetic. Vagus nerve. It, do you see, after visiting to the abdominal cavity, sprills, and do you see, comes, do you see, completes into the plexus, celiac plexus, for example, into the gastric left plexus. By gastric left plexus will come to the intraorganal ganglions of the stomach. Do you see? If this will be, for example, small intestine, that you can see the branches of the vagus nerve, and this is very important moment, will, do you see, complete into the aortic plexus, mesenteric superior, and will come to the, do you see, by subdivision of the mesenteric superior into the intestinal plexus, will come to the subserous, submucous, intramuscular ganglions of the small intestine. Every time for the parasympathetic systems, the ganglions will be in wall or near the organ. Do you see? Near the organ. Before this will be every time preganglionar fibers of the parasympathetic. But about what I want to inform you, do you remember for what I explained you development of the gastrointestinal tract? Sometimes can be ulcer of the stomach, can be ulcer of the intestine. And we have many, do you see, methods for the treatment of this disease. And besides operation will be some, do you see, another methods. And this will be, do you see, some medical preparates which patient can drink. Sometimes we can do injection, and sometimes we do blockade. Block. Do you see, what is block? This is anesthesia, very, do you see, very active anesthesia of the vagus nerve. If will be ulcer of the stomach, we will do block of the right and left nerve. Why? Because, do you remember, right nerve from back came in front of left nerve, do you see, it is located behind, and they spread. Left nerve here will spread to its end branches, which will complete, do you see, into the all subdivisions of the celiac plexus for the organs of the upper floor. Right nerve came in front of, and the way in front of is free, because it will continue into the aortic plexus, into the mesenteric superior plexus, into the intestinal plexus, because if will be ulcer of the small intestine, we will do block only of the right nerve. Did you understand? You can see this is information about vagus nerve. Vagus nerve is king of the parasympathetic innervation because it controls the biggest volume of the vegetative objects of our organism. Pelvic box. Here we have